In this video, we'll talk about treatment as prevention, or TASP, which is the concept of treating HIV to prevent further transmission of the infection. We will be discussing the following topics: the evidence for treatment as prevention, the concept of U equals U, or undetectable equals untransmittable, and finally, we will look at HIV elimination goals. Let's start by reviewing some of the evidence for treatment as prevention. Here you see 4 studies illustrating evidence of treatment as prevention. I'll talk about each of these studies separately. First, a study called HPTN 052 was an international study that enrolled over 1,700 heterosexual couples in which one person had HIV and the other person did not. This is called serodifferent or serodiscordant. Serodifferent means that one person in the couple is living with HIV and the other person is HIV negative. This is also known as serodiscordant. This study was conducted in 2011 before ART was recommended for every CD4 count. So in these groups, they looked at early versus delayed antiretroviral therapy. And as you can imagine, in the delayed ART group, there was more risk of HIV transmission to the partner. And in the early ART group, there was far less HIV transmitted to the other person. And then they looked to see if there are any linked transmissions in the group of people who were on antiretroviral therapy, and there were no linked transmissions. So what does that mean? So in these serodifferent couples, if somebody was on antiretroviral therapy with a viral load that was less than 200, then none of the HIV-negative partners got HIV from their partner. So that was some of the first evidence for treatment as prevention. This study showed that those on antiretroviral therapy were not transmitting HIV, although that was not the purpose of that particular study. The next study, called Partner 1, was of 888 serodifferent couples. There were 548 male-female couples and 350 male-male couples. Again, an international study. There were 58,000 condomless sex acts, and in those 58,000 condomless sex acts, there were 0 linked transmissions in couples where the partner living with HIV was virally suppressed. The strongest evidence comes from the Partner 2 study, where there were 783 serodifferent couples, all of whom were men who have sex with men, and all of whom were on antiretroviral therapy and had viral loads of less than 200. And of those, they were able to calculate 77,000 condomless sex acts. And in those sex acts, there were 0 linked transmissions between the partner who had HIV and the partner who did not have HIV. And so that was a hugely powerful number. And similarly, the Opposites Attract study included 350 serodifferent men who have sex with men who were also having condomless sex. They had about 17,000 condomless sex acts, and again, 0 linked transmissions. So when we put together all of those studies, we see that after over 100,000 condomless sex acts, there were 0 transmission events, which amounts to very strong evidence that HIV cannot be transmitted through sex when the HIV-infected partner has an undetectable viral load when it's being controlled with ART. These studies and others produced the concept of U equals U, or undetectable equals untransmittable. This is the message that any individual with an undetectable HIV viral load, or really a viral load of less than 200, is incapable of transmitting HIV to their sexual partners. This has led to many international campaigns for U equals U, which seek to empower people living with HIV. This concept is really life-changing for people because it gives them a sense of freedom while also incentivizing viral suppression at the individual level. So, the DHHS guidelines from 2019 say that all persons with HIV should be informed that maintaining a plasma viral load of less than 200 copies per milliliter, including any measurable value below the threshold value, with antiretroviral therapy prevents sexual transmission of HIV to their partners. Patients may recognize this concept as undetectable equals on track or undetectable equals untransmittable or U equals U. But you may find that many of your patients don't actually know about U equals U, despite it being so important. Many patients live in fear of transmitting HIV to their partners, and this has terrible consequences on their relationships. It is never too late to discuss this with your patients because it's incredibly empowering. In addition to having transformational effects on individuals living with HIV, the U equals U concept is transforming the global HIV epidemic. While the global HIV community has always considered treatment important to minimize negative HIV outcomes and death on an individual basis, we now understand that helping our patients achieve viral suppression is also vitally important to prevent onward transmission. This could be key in achieving HIV elimination goals in the future. So let's pivot here and take a look at the 95-95-95 goals. By the year 2030, the current goals are that 95% of people living with HIV know their HIV status, 95% of people who know their status are receiving treatment, and 95% of people on HIV treatment have a suppressed viral load so their immune system remains strong and the likelihood of their infection being passed on is greatly reduced. In summary, when it comes to treatment as prevention, studies have shown that HIV cannot be transmitted through sex when the HIV-infected partner has an undetectable viral load when it is being controlled with ART. U equals U, or undetectable equals untransmittable, is the concept that any individual with an undetectable HIV viral load is incapable of transmitting HIV to their sexual partners. The U equals U campaign aims to empower HIV-positive individuals and promote viral suppression for individuals. U equals U could be key to achieving the HIV elimination goals. The 95-95-95 goals are that by 2030, 95% of people living with HIV know their HIV status, 95% of people who know their status are receiving treatment, and 95% of people on HIV treatment have a suppressed viral load.